All right. Well, good afternoon or good evening, wherever you are. This is Cancer Care in the Time of COVID. We're talking through taking care of cancer survivors through this crisis. And when we are defining survivors, we are talking about from the time of diagnosis through the lifespan. I'm excited today to be joined by one of my colleagues here at the University of Kansas Cancer Center, Dr. Lauren Nye, and I will let her introduce herself, and then I will introduce myself.
Hi, I'm Lauren Nye. I'm a breast oncologist at the University of Kansas Cancer Center and also have a focus on high-risk breast and survivorship.
And I'm Jennifer Klemp, and I'm a associate professor of medicine in the Division of Oncology, who also works in cancer genetics and in cancer survivorship. And so today we're going to talk through kind of some common questions and normalize this experience that we're going through day to day, and the constant changes in responding to how we can care for our patients and ourselves in the time of COVID-19. So I'd like to start by asking Dr. Nye a question, kind of how are you managing your patients during COVID-19, and are you making any changes and adjustments as you're caring for breast cancer patients?
Yeah, so right now in Kansas, we are not at the peak of our COVID cases. And so we're still seeing all newly diagnosed patients, seeing all patients needing treatment, and those that are experiencing symptoms. For our follow-up visits, we're really trying to help flatten that curve and keep our cancer center a safe place for those that need chemotherapy or immunosuppressive therapies. So we're trying to move all follow-up visits, chemotherapy teaching visits, survivorship visits for those without symptoms to a telemedicine platform, which we've got up and running in about 2 weeks. So we just opened that up this week. We are in the process of also trying to continue offering our high-risk consults via telemedicine. So those are individuals without a diagnosis of cancer, but who may be at high risk because they have a mutation or an abnormal breast biopsy.
Great. And I think, in my response to that same question, I do a lot of education as well as collaborate with colleagues like Dr. Nye to help our catchment area really kind of have the tools and resources they need to adjust to changing practice. And I think we've been able to really utilize some of those telehealth tools, as Dr. Nye highlighted, not only for consultation, but to help in this education process across the region, and as you can see from our discussion now, across the country. I think one of the other tools that we've really been able to leverage is we are an active Project ECHO organization where we use didactic and case-based learning to really help change practice and drive those changes. We've taken an existing survivorship series, and in April we will do 3 additional sessions that will be a mini-series focused on self-management and really changing to those adjusting times in light of COVID. And I think that I would like to pause there just for 1 second and incorporate Dr. Nye into this question as well, is that one thing that I think that we're seeing as we take new patients or return patients is that we may be okay adjusting to telemedicine because our practices already use it, we're on WebEx so often, but our patients really aren't. And I think that that's been pretty universal, is that across the country, how do we very quickly, onboard and prepare our patients for this changing type of visit? And Dr. Nye, do you have any suggestions of what you've done to sort of better empower your patients? And I think you told me the other day about a new patient who came in, and they were coming in by themselves, and that's a pretty scary visit for a newly diagnosed patient.
Thank you, Jen. I was gonna mention, in terms of the telehealth, it's definitely a steep learning curve for providers, even though I've using platform and Project ECHO, which is the platform we're using for our telehealth visits right now. But it really takes a team approach, and that includes having somebody on your team walk the patients through getting set up for a telemedicine encounter. But it's possible. I last week had an encounter with one of my older patients from rural Kansas, and it went great. But it did take some guidance, and they're a little nervous about it as well. In terms of how patients can prepare for coming to the clinic. I think we need to realize that when they have to come by themselves, that's really scary. And it's really uncomfortable for the patient as well as the physician, because we also can't reach out and provide any support to them physically with, holding their hand or just touching their back to provide just some meaningful support when they're there by themselves and they're scared. So I've been encouraging patients to have their family or friends on the phone, FaceTime if you can, have somebody else that's taking notes that's on the phone so you can really be engaged in that consultation. And then talking to your family and friends ahead of time to have this list of questions that everybody wants the answer to, so that you don't leave the consult and feel like you didn't answer anybody else's questions.
Yeah, those are great suggestions. So we need to build a little checklist of what patients kind of need to do in preparation, because that is an adjustment, and it will take coordinating kind of their support network prior to that visit as well as during the visit. Yep. And I've been using telemedicine in my practice solely for the past 3 years. So for me, it definitely has been, business as usual. However, I am working more with families now, since I provide primarily genetic education and counseling, where we're really able to engage that whole family in family meetings versus just a couple like I talked to, in Friday in Dodge, Kansas. Now I can talk to an entire family who are in 4 or 5 different places. And we're really prioritizing more of that group education to facilitate the basics and the information that we need. And then the great part is that genetic testing companies are all drop shipping kits directly to patients' homes. So, I know from your practice too, Dr. Nye, that's been really great, is that we basically can have patients spit into a tube and ship it off, and we don't have to expose them to an unnecessary visit to a lab draw station or the clinic. So the next question I wanted to ask is, what are your greatest concerns, outside of the volume and the peak concerns and the PPE issues? What are your other concerns that you have as we embark in trying to, as you said, sort of, deflate that curve?
I think the biggest thing that, and I guess I shouldn't speak for everyone, but the biggest thing that I hear healthcare workers worried about is spreading the virus, is bringing it home to their family, bringing it home to their children or their elders, or bringing it back to their immunocompromised patients. I think when you work in a cancer center, that's a huge concern, is am I going to spread it to my patients and compromise their health? Also worry about treating patients with immunosuppressive therapy. So I have to think twice before I recommend a certain therapy regimen if it's going to be much more likely to immunosuppress them and put them at a higher risk of either infection with the COVID virus or complications from the COVID virus. And then something that we're starting to see change recently is having more limited access to clinical trials, especially for some of our metastatic patients. While we know clinical trials are not proven therapies, we do hold them in high value and think that they're a huge benefit to patients. And right now we have to balance that risk with the potential benefit of the clinical trials, and a lot of those trials may go on hold soon.
Absolutely. And I think that you brought up a really good point about, your concerns about immunosuppressed patients. And I think the Italian data that's been coming out showing, the risk to our cancer patients and COVID is reinforcing that. But are you making any adjustments? Like maybe, are you using some alternative sort of treatment regimens? Are you trying to consolidate, or, are you making adjustments on that case by case basis?
Right now, like I said, in our current state in Kansas, it is more of a case-by-case basis. As a group, we have developed some guidelines as to where we're going to move towards as the burden of the infection worsens in our area. But a lot of patients are worried about this too, so they're bringing up that discussion even before I get there, saying, well, maybe I don't want to start that drug yet. Could I put it off for a couple of weeks or a couple of months? So I don't have to make as many frequent trips, or so that I'm not as immunosuppressed. I've had patients whose relatives or family members that live in their house work in an environment where they're much more likely to be exposed. And so they're worried about being on more immunosuppressive therapies. And so you really have to take in the whole picture and add another layer of risk-benefit discussion to our conversations about therapies.
Absolutely. And I think I read an article yesterday about how even like within isolation within the home, if there is a patient undergoing treatment or is immunosuppressed, they should be isolated in the isolated home. So I think that you're bringing up kind of this another level of prevention, which is a whole new world, and this all requires more conversation with patients and their families so that they really understand the severity of what we're talking about, to take those precautions so they're not bringing things home to their loved ones who are immunosuppressed or undergoing treatment. So I think from my perspective, I had similar sorts of concerns. One was that as we try to prepare for the tsunami, that, we are a little bit behind, obviously, the coasts, and things are kind of moving in. But I feel like I worry, are we going to be able to pivot as fast as we'll need to? And in listening to some of the experience from especially New York City, where they're pivoting sometimes 2 and 3 times a day. So they have all these preparations put into place, and then all of a sudden, they're having to really make changes on the fly. And this is something where we can prepare as much as we want, but we have to be flexible because these are new times that we're living in, and we haven't really had to deal with this before. So I do have that concern. And then the public really still kind of not taking those precautions. I know in the little park right down the street from me, I finally saw tape, kind of that construction tape around all the playground equipment. So, although it's very tempting to want to jump on, the swing set, those are things where we know that we need to be cautious, and we need to practice good precautions from the youngest to the oldest. And I really hope the general population as a whole, kind of takes that a little bit more seriously. And then once again, the clinical trial concerns, and really by limiting access for some patients, especially trying to prevent them from having any inpatient stays, as well as just overall the slowing down of research, that's going to put us behind in regards to those next steps and those next opportunities for patients. So I hope we'll be able to accelerate as we get through this initial phase, but I do worry about how much this has sort of set us back. Do you have any other?
I do think it's going to.
Yeah, go ahead.
I was going to say, I think this is going to open up some opportunities as well, right, especially in the area of clinical research. We hear a lot about disparities in clinical research not reaching certain populations, and we ask why. And some of those is access. And as we're moving a lot of things to virtual, including some of our clinical trial check-ins and visits and mailing drugs if needed, I think we're going to see more opportunity to decrease those disparities in clinical research and allow access to clinical trials for more individuals.
So basically, you're kind of saying we can take this opportunity as we virtualize and hopefully translate that into our next sort of generation of clinical research.
Definitely.
Yeah, hopefully. And the other thing that you brought up, which I hope that, especially the sessions we're getting ready to do as part of our Survivorship Echo, we're really reaching our rural providers, because there are going to be some urban-rural differences, speaking about kind of those disparities. And by our rural partners across our catchment area having access to experts, I'm hoping that will reduce some of that urban-rural difference, that as more cases of COVID are identified and we're managing these complex cases, that we'll be able to support our partners who have sometimes less access to those resources than we would in an academic medical center.
And I think we still see some of those disparities even within the cities as well, even within our own city, not reaching certain communities because of transportation or because those individuals have obligations either to family or work and they can't make it to our academic cancer center for a visit. Telehealth will virtualize that and allow them access.
Absolutely. So as you're kind of processing all this, there's a lot of challenges and there's not a one size fits all. What are you personally doing differently in day to day as you're trying to live in COVID-19?
This is really fluid. I am trying to be in very close contact with my colleagues in breast surgery and radiation. As things change, that may change my decisions on therapy for patients. But right now, I'm trying to support as many patients as I can via telemedicine without compromising care. And I think that's really the key, is we are doing everything to still treat patients with cancer, diagnose cancer, and we're not really holding back. But at some point, we are going to have to pause and pivot, and we're going to have to do most of these visits via telemedicine as the burden of the infection worsens in our area. And so I'm trying to push that as much as I can right now. And then, like we talked about, I am considering less immunosuppressive therapies if there's a reasonable alternative option. But again, not holding back if treating the cancer requires an immunosuppressive therapy right now. I hope that's something that doesn't have to change as things worsen. Right now in Kansas City, we're hoping that our burden of disease does not get as bad as it has in New York. However, it may.
Yeah.
And then considering dosing options that allow for less frequent visits. So drugs like ovarian suppression, Lupron, you can do Q3-month dosing instead of monthly dosing.
Right.
There's other drug regimens that you can change the frequency of dosing to allow less visits to the cancer center, less exposure out of the home.
So are you finding, as you're kind of teeing this up with your patients, are you having to do a little bit more expectation management, like helping them understand that there may be these pivots so that they're better prepared, or are you sort of giving them that in little stages? Like how does that work as you're talking to patients?
I have found that most patients with a diagnosis of cancer or history of cancer are well aware of the burden of the infection and the need to pause and pivot. And they're calling us asking, do I need to come in for this visit? Do I really need to do that? Can I hold my therapy? And so I think a lot is being prompted by patients, and we're providing the counseling to help weigh those risks and benefits. But it's been a pretty easy discussion with patients.
Good. Everyone has a common goal, so that's great. And I think from my perspective, really trying to establish and use current modes of communication. What are we already doing? Let's don't try to reinvent a wheel, but let's maximize our community so that we can share those best practices. And with all these things coming at us, I feel like a mile a minute, we need to be able to digest that in easier parts. And I feel like we need to maximize a lot of our greatest sort of needs of our patients through use of current and existing communication pathways that we use. With this work from home, I know I personalized a little bit here, but yes, my cats are loving it, but as a extrovert, it is very difficult. And I feel like, as we think about it, I know I definitely try to, as do my colleagues, we text each other or touch base to make sure, we're all kind of surviving and that everybody's doing all right. And so I think that as you think about your circle of support, yes, you have your family and your good friends, but we also have so many changes that it's good to sort of touch base with our colleagues, our nursing staff, our supportive care teams, really all the folks that we depend on for our patients, but also just to make sure that circle of support is there. And then the last thing I've tried to do is, I feel a little different role because within our cancer center is trying to really support my colleagues who have a different scope of practice day to day. And so I'm trying to think about, are there things I can do research-wise or administratively so that they can focus more on their clinical tasks and the pressing issues. But a lot of our momentum in regards to research and so forth doesn't get left behind. So really trying to see where we can pivot to support each other and make sure that those our shared goals and priorities are being met, and on a kind of a regular basis of doing those check-ins. Do you want to add anything to those? I know some of these are a little less clinical, but maybe you have some other insight as well.
As an introvert, being home hasn't been horrible. I do still feel the need for connection, though, with other people. And I feel like being a healthcare worker right now, it was a little lonely in the beginning of the COVID-19 pandemic because I knew what was coming. And I couldn't really discuss that with individuals outside of healthcare because they really thought I was crazy, that I was making things up. And yeah, when you talk to your colleagues, everybody was on the same page. And so I needed that support from the beginning. And interestingly, I found a lot of that support utilizing things like social media. And so Twitter has been a cause of anxiety early on because you were hearing about things happening in China, happening in Italy, and you knew what was coming, and now in New York. But at the same time, a great opportunity for support from people from around the world and an exchange of ideas that has been really helpful like this.
And you have a pretty good Twitter presence. What is your Twitter handle?
It is Dr. Lauren Nye, LAURENNYE.
Great. And I respond and follow Dr. Nye, and I'm Dr. Jen Klemp. So we can all follow each other and share best practices, information, and support via social media platforms as well. So you talked a little bit about kind of how the work doesn't always translate outside of that environment, but as we're thinking about work-life balance, kids' school, and the shelter in place, how are you adjusting as a working healthcare professional caring for cancer patients?
So right now we're lucky our daycare is still open for essential workers, and that is wonderful since we have our dining room is now our office, and my husband and I share that office. It's also a cause of stress sending your kids to daycare and worrying about, are they going to get something? Are they going to bring something home? Am I going to send something to daycare? But right now it's really a necessity. My husband and I definitely have had a little trouble sharing our office space, but we have used the third coworker approach. So Fred or Sally is responsible for turning the temperature up in the house or leaving the countertop dirty, and having somebody else to blame has lessened some of that uneasiness of working together. And then really I found most important is trying to disconnect. So putting down my computer, putting down my phone, and going out for a walk and not checking my email or not checking Twitter has been really important for my mental health, I think.
Yeah, those are great suggestions. And I think it is interesting when two people are now working from home, when, we're used to having that separate space all day. Those are transitions that we didn't have an adjustment period. It was sort of, you just jumped in and there you go. So from my vantage point, I do like to cook and I find it very therapeutic. So one thing that I've been doing is, on my 7 hours of conference calls and WebExes a day, sometimes if I just have to listen, I'll actually prepare one of my favorite recipes. So I am a multitasker, and that's been nice to be able to be, close to the kitchen. And with, using Zoom, and a lot of the kids today are using Zoom for their classrooms. I actually started last week with a group of tweens. They're all tween girls. We're doing coping with COVID, and we're using journaling as sort of the basis for that. Why do you journal? How do you journal? And it's been fun because they bring a different energy. And really, these happen to be all daughters of women in healthcare. So some of our nurse practitioners are physicians. And so this is a break for the parents. But next week is talking about funny things your pets do and sort of researching it and writing about it, but they're also going to be learning good life skills because they help choose the topics, and a lot of them are pretty like real serious topics. And I hope that the lessons that we talk through, the use of journaling to sort of process emotions and kind of what they're going through, will translate post-COVID. And then,
that's awesome.
Yeah, it's fun. And so we have, it's set up through June. So we'll see if I can handle it through then and if the girls can handle it too. So it's been fun. And then trying to get organized and plan for the future, right? We have to have some element of hope. So I think that this is a good time as we're staying in the moment. We're also thinking about next steps. Yeah. So what is one positive that you could kind of take away from COVID-19 and the pandemic?
So I answered this with unity that comes in a time of crisis when you see everybody lifting each other up. And so thinking about all the healthcare workers coming together and supporting each other and stepping out of roles that are in their comfort zone to take on other tasks, and not necessarily even talking about what's going on in New York or what happened in Italy in terms of physicians and providers stepping into a different specialty, but just seeing our nurses and our other colleagues take on a different role going into the virtual platforms. Times, I think that's really uplifting and needed right now.
Yeah, that's a great word that really does has so many meanings. But I think the way you described it is very powerful, and really people have risen to the occasion. So that's a good term for what we're going through. I've been sort of keeping a list as we've gone through this. I'm only on number 3, but I think that with each sort of thing that happens that's a crisis or life challenge, it does give us that ability to sort of reset. And so I'm hoping that some of the behaviors that we've already been talking about, like checking in on each other more, and like you said, you take walks with the family, and we're getting out and we're actually engaging in behaviors that are really healthy behaviors. So I'm hoping that as we embark on this kind of new world order, that we'll be able to maintain some of those behaviors post-COVID, and I look forward to trying my hardest to keep some of those more positive and healthy behaviors. And then from the vantage point of what's important to you right now, tell us a little bit about how you're framing that.
The biggest word that has come to mind during all of this has been grace. And by that, I mean giving grace to myself mostly when I'm trying to be a mom of 2 kids at home who can't go outside, and be a physician who's adapting to telemedicine, and be the one laying the rules that I have to be separated from my parents who want to see their grandkids so badly, is just giving myself grace that I'm not going to be perfect at everything, and I'm not going to do everything right, but I am going to give everything 110%. And I think realizing that that's what everybody else around you is doing as well. So having patience with your family, having patience with your colleagues during this time is really important, and giving them grace as well.
That's a very profound sort of way to look at it, but it's putting things into a perspective that allows us to realize that we can only do the best we can with what we have today. And I think that's a great way to frame that. And that should be our mantra for the day, is actually for this journey is grace. And that kind of feeds into my thoughts, which were, obviously we're all trying to be more mindful, but we actually need to be more mindful, right? We need to realize that, especially in a crisis, things are going to change so rapidly. And we may be resetting and pushing our reset button multiple times during a day. We probably need to be less reactive to things that just aren't that important, and focus on the things that are important. So I think that kind of picking your battles and focusing on what's important, and giving yourself, like you said, sort of that break of reset, push the reset button, and let's just start, fresh from here forward. Those are all good strategies and things to help us deal with all the changes that have so rapidly happened.
I think the mindfulness piece is important too. I've started using some apps that help with meditation and things like that, which I think I never did before. And so this has been an opportunity to practice mindfulness and meditation, and even trying to get my kids to do some yoga and thoughtfulness at least has been something positive that's come out of this.
Yeah. I think that's a great example that, there's all these tools we talk about, but we rarely get to deploy them. So it's nice that you're actually able to try some of those strategies and stay in the moment and kind of reprioritize, which is refreshing. So as we think about kind of the takeaways that we want to give to our friends and colleagues across the country, what are your takeaways of COVID-19?
My takeaways were that I think telemedicine is going to be pivotal in oncology care, And I think COVID-19 has accelerated that. I think we're going to find that it is a very helpful way to practice oncology medicine, and our patients are going to like it. And I also think finding your outlet is important, and then continuing that when we get post-COVID, because during COVID-19, it's insanity and there's a lot of things that are out of our control. But I think as the pandemic decreases and we're trying to get back into our routine, and we have all these appointments and visits that we've deferred and all these projects that have put off, they're all going to come crashing down at the same time. And so trying to work that outlet into your daily life so that you can continue it after, because I don't think it's going to be a whole lot calmer for a while.
Right. I like that you're wording that. It's sort of the re-entry, post-COVID. It's not going to be an easy transition, and it's not going to be, a single moment in time. So having the tools you need in your toolbox will really be helpful for re-entry. And I do think, obviously I've been using telemedicine for a long time. You brought up a point that patients really will like it, and they do. Some of the best compliments I receive from patients is, I didn't have to, drive 4 hours and to see someone, and I feel like I got a lot of value and was able to really not only maximize their time, but they're not having to take extra time off from work. And in this case, they're not having to have those exposures, and really they can include other family members much easier in those visits, which I think is important for a lot of our patients, because we know that being the translator or the note taker is a big responsibility, because you can ask 3 people who heard the same thing and they all hear it a little differently. So it's important that we have these opportunities for patients to really include their support network in these visits. And I think telemedicine will really give patients and providers that opportunity. And I think that, my takeaways kind of build on yours, and that connection is vital to life. We thrive on connections, whether we're introverts or extroverts. And a crisis really accelerates the importance of those connections. So right now, obviously, we need to practice what we preach and touch base and really nurture our support network. But we need to continue that, and I hope that is a takeaway. And with this fast-paced environment that we live in, and we're constantly, overcommitted and overbooked and you name it, reprioritization is shocking, but maybe not such a bad thing. So how will we take this into the future and as we do our reentry? And then self-care. You highlighted some great strategies for self-care. I always love to talk about building, your tools and your toolkit, and we really have to refine those and not only talk about those, but actually figure out how we use them on a regular basis so that they do become a habit and they're not just something we do sporadically or something we do in theory. They actually become part of our day-to-day behaviors and become a habit. So I think that our discussion really today was meant to kind of normalize that everyone's experience is a little different, but maybe a little similar. And that, Dr. Nye and I were able to share, some of the experiences that we are having here in Kansas City. We both are at the University of Kansas Cancer Center, and want to thank you for participating and being part of this discussion today. And Dr. Nye, do you have any last thoughts that you'd like to share with the audience?
No, just thank you for letting me participate and share kind of our experiences here in Kansas City. I think the biggest thing that's been helpful to me going through this experience is hearing about what other people are doing and changing and adapting to. And so it's conferences like this that help us hear that information, because we can't always tune in at the same time.
That's exactly right. And we do learn so much better by sharing, best practices with each other and taking those perils that we can, incorporate back into our lives or our practice. So we are so thankful to share our experience with you today, and we wish you health and happiness.